very much for joining us. I'll now introduce our speakers and performers today, Dr. Rachel Barr and Megan Ferris. Rachel and Megan are with the National Ballet School and Baycrest Health Sciences. Dr. Rachel Barr is Director, Research and Health at Canada's National Ballet School and is a postdoctoral fellow with the Trent Centre for Aging and Society. As a dance artist, she's been part of the multidisciplinary team that developed Baycrest and National Ballet School's approach to dance programming for older adults. As a researcher, she's been involved in several projects investigating how and why older adults can benefit from accessible dance innovations, including older adults living with Parkinson's disease and dementia. Megan Ferris is a community dance specialist and the coordinator of partnerships and evaluation at Canada's National Ballet School. She's a graduate with distinction from the Ballet School Teacher Training Program and the Faculty of Arts at Ryerson University, specializing in early childhood studies. At the National Ballet School, Megan's role focuses on providing dance programming to people of all ages and all abilities, while coordinating partnership development as well as evaluation for on-site, in-community, and online programs. Along with teaching at the ballet school in the community dance program, Megan is also currently on the faculty with the Teacher Training Program and the Associates Ballet Program. Welcome, Megan and Rachel. Our presentation will begin with an introduction to Sharing Dance by Dr. Barr, and then Megan will take us through a dance routine. Thank you very much. Rachel, it's over to you.
Thanks so much, Susan, and welcome everyone. I know I speak for Megan and myself when I say how joyful it is for us to present our work to you today. So we are going to be talking about dance and its benefits to older adults and their caregivers. And specifically, we're going to be talking about Sharing Dance, which is the program that Canada's National Ballet School and Baycrest Health Sciences developed together. So just a little bit of background first about the two organizations. Canada's National Ballet School is known for its excellence and expertise in dance training. So we're most renowned for our professional ballet program, where we're training the next generation of Olympic caliber dancers. But more and more, we are also focusing our expertise on bringing high quality community dance initiatives. Baycrest is renowned for its work in geriatric care and geriatric research. And back in 2013, the two of us as organizations got together to imagine how we could bring the excellence which we represent in our fields to an accessible dance program for older adults who otherwise wouldn't be able to access dance. And initially we started just to pilot some programming in person within the long-term care facility at Baycrest. And eventually we spread and we're offering the program more within the Greater Toronto area. But we recognized a key limitation of this was that our expert dance teachers, such as Megan, couldn't travel across the country on a daily basis to share our program, which we were getting great feedback about with Canadians. And so in the interest of maximizing the accessibility of our programs, we began back in 2016 to experiment with a video stream version of our dance program, which we had been sort of testing out a little bit initially as a live stream, but then moved to a video streamed program. And we partnered with researchers at Trent University in Peterborough, Ontario, and Brandon University in Manitoba to really focus on communities where we knew that access was very much restricted. And so our initial pilots actually were in rural communities. So fast forward a couple more years, and we, up until the pandemic, were really active across the country in sharing dance through our video streamed grouped programs. So groups would gather either in community spaces like community centers, libraries, recreation rooms in churches, as well as within long-term care facilities and retirement homes to participate in our group classes. Now, the pandemic certainly accelerated the development of an at-home version of this program, but it was already something that we had begun to consider, I would say, because again, in the interest of maximizing accessibility, we recognize that some of our potential dancers were not able to leave their homes. So moving forward to our current offerings, the program that Baycrest and NBS developed is currently available in two different experiences. We have seated classes, which are done entirely from a chair. And these are really designed for participants with significant physical and or cognitive challenges. And so even though some people with cognitive challenges may be comfortable standing, we determined this is for somebody who may not be able to make the decision of what's safe for them. And so it's done completely from a chair. And it's done at a pace that would be easier to follow for somebody who needs things to go a little bit more slowly. Our other version of our program is a standing class with seated options. And again, this is for participants who may need some accommodation, but would potentially at some points in the class want to participate from a standing position. So it's a little bit more of a challenging class, and the pace is a little bit faster. In terms of how we deliver this, we do offer the program as a group program that's offered over usually about 8 weeks that you can sign up for. Obviously, during the pandemic, this has proven to be a little bit more of a tricky experience, but we're looking forward to a time when we can all safely gather in groups and dance together again. And as I mentioned, within the pandemic context, we began to pilot and are now offering an at-home version of our classes, which are slightly shorter experiences, but that you can sign up for and participate in each week. So now that I've spoken a little bit about our programs, I want to talk a little bit about the research and evaluation. Throughout the development of our programs for older adults, we have been partnering with researchers and evaluators to understand what our program is and how it impacts older adults and the people that care for them and work with them. And so the work I'm about to present is based on 3 research and evaluation projects. So Taylor Newberry, or TNC, are the ballet school's evaluators for our community dance projects, which are being funded by the Public Health Agency of Canada. The research department at Baycrest, known as KL Care, they have also done a research project, a formal research project about the remote delivery of our program. So some of the data is based on that. And thirdly, another research project, which I alluded to earlier, was led by a researcher out of the Trent Center for Aging and Society at Trent University. And I'll refer to that project as well in these slides. So in terms of physical benefits, this is consistent with everything we know about exercise and the research that already exists about the benefits of dance in older adulthood. What we have found to date is that overall improvement in perceived and measured physical health is something that our older people are experiencing. And this is for both our seated dancers and our seated standing program dancers. And I've just included some of the specific measures that we've actually captured were significantly improved. So for example, arm curls represents strength in somebody's arms. The sit in reach test, which would indicate somebody's range of motion. So really practical measures when you're trying to understand how the benefits could actually impact the life of an older person. And I've also included this quote from one of our on-site facilitators who was talking about the physical benefits and said, "It was really neat to see some of the residents' flexibility in these classes. I think it's really supplementing some of the work that our physio team is doing." And so here we see both, quantitatively and qualitatively through this insight that participants of our program of Sharing Dance Older Adults are experiencing great physical benefits by participating. Moving to benefits of mood. So from our Care led project as well, we did find overall improvement in perceived mood by our participants. And again, this is found both in our seated program and our seated and standing classes. And then also I've just pulled some reflections from people who have participated in the at-home pilot that also speak to mood. So I'll just read these out loud. "It just made me feel good, important for my morale amid the pandemic." And of course, this is somebody who's dancing at home. And another quote, "I have severe COPD and arthritis. I was able to do this class. It gave me a great sense of accomplishment." So again, we're understanding that this opportunity to dance, this program is enhancing how people are feeling about themselves. And then in terms of social benefit, what we found through the qualitative study that came out of TCAS was really that the program was encouraging connections and intersubjectivity between participants and communities. And I've put an example here from a paper we recently published in the Gerontologist. So the dance that the dancers were asked to do was actually about commuting to work. So there were all different movements that you had to do when you were going to work. You might be riding your bike, and we had a movement for that. We had like a walking to work. We had sort of waiting for the bus movement. And so all of those were what they were being asked to do. Oh, it just flipped off. But I'll just read this quote before I flip it back. And I'll just read this quote. "So a family carer turns to his wife, a resident participant, and as he circles his hands around each other, mimicking cycling, he says to her, 'I got in an accident on my bicycle.' He laughs and leans into her, and she responds, 'Oh, we're going really fast now.' And they both laugh. She says, 'Woo,' and laughs at her husband as her husband speeds up his cycling motions." So what we're seeing here is that the dance class actually provided an opportunity for the carer and for the older person that they're caring for to socially interact, to have a playful, lighthearted moment within the context of the dance class. And the finding really from this project that's highlighted here is that it's the dance program itself that fosters this through its creativity and engagement with the dancers. Now, if we're going to talk about caregiver benefits specifically, I want to just highlight a few, which of course will be relevant to those listening in today. So the physical benefits that older person will experience, anyone who dances is going to experience. We know that dance is physical exercise. It's good for you. So as a caregiver, if you're joining in, you'll experience that too. And I know when I was teaching the program in long-term care, a lot of the professional support workers used to tell me that they liked to come to the class because they like to dance. So they were enjoying it as well. The other great benefit that we've observed is really the opportunity to meaningfully engage with the person or persons that you're caring for. And so, a lot of I'm sure you know better than me. A lot of the role that you have to play is very task focused, and this is an opportunity to engage in something meaningful with the person you're caring for that hopefully is fun. The other benefit as well that we do see a lot is that it offers an opportunity for respite. So carers who would bring their older person to a class can go and do something else at that time, hopefully for themselves or something that needs to get done. So it's a little bit of a break. But even in the at-home model where you can turn on the program, so it's something meaningful that the person you're caring for can do while you're taking care of yourself or other things that need to happen. And it's something that can be very engaging. So really the benefits that we see for the older person are also important to consider in the context of the caregiver. So I'm a big believer in embodied learning, in experientially understanding research. And I think really the best way to do that is now to turn our attention to Megan. I'm just going to see if I can spotlight her. There we go. And I will turn it to Megan now.
Thank you, Rachel. And thank you, as Rachel said, for inviting us today to share what we love and what we're so passionate about. I'm really excited to be able to invite all of you to participate in this little bit of movement and to really experience all of the things that Rachel has spoken so beautifully about in this presentation. So before we begin, we'll just take a second. As Susan mentioned, you don't need a lot of space to participate today. Just check that you can move your arms sideways, forward and back. Throughout this, I might expand my arms out to the side, but you can choose what's best for you today if that's a little bit or a lot. We'll also move our feet a little bit, so just check that you have the space to move your feet freely. That might be forward or side. Again, if I'm demonstrating side, please feel free to use the space that you have. If at any moment you need to take a breath, take a moment, take a little rest, please feel free to do so and then join us back when you're ready. We're going to begin today. I'm going to share an excerpt of what our programming, our classes for older adults is like. So this won't be a full experience today. I'm going to share a couple of dances with you just to give you a feel for what it's like. This first one, we're going to start a little bit slower, feeling the music, feeling the movement, and then we'll progress and do something a little bit quicker. This first one is a really great one because Rachel was talking about that connection, that storytelling, and sometimes the storytelling also helps us to remember what's coming next. So for this one, we're going to imagine that we're out for a stroll, we're out for a walk, and you can choose where that is today. It might be through a forest, it might be through a winter wonderland. Please use your creativity and choose where you're walking today. We'll show that with our arms, and we'll reach one arm forward and then switch. So there's a bit of a reach and a switch happening. Again, this can be as big or as small of a movement as you'd like. While we're out for that walk, we might see someone along the way. So we'll take our hand to our heart and open it out to those around us. You might actually see someone while you're doing that, or imagine that you're making that connection with someone. Or maybe you're just taking a moment to really take in the environment, take in the atmosphere, and feel that gratitude for what we're seeing. The last piece of this that you need to know, we'll imagine that sun, that warm sun is shining all around us. And we'll make a round shape with our arms, lifting it up as high as you would like to go, taking a deep breath in, and then feeling that expansion as the arms open around us. Those are the only pieces you need to know today. We'll take that stroll. We'll take a moment to enjoy what's around us. We'll have that sun shining. You can follow along with me. As the music begins, we're going to take a moment to feel the rhythm, feel the quality of the music. We'll sway a little bit. You'll see my arms getting involved. You can just follow along with my movement, and then I'll prepare us. As I reach that arm forward, you'll know that it's time to go into that walk. So here we go with the music. Wonderful. So we really had that opportunity of the repetition and feeling that movement throughout our body while storytelling and feeling the creativity. Let's try one more together, and I'm going to pick up the pace a little bit. Generally, we start off a little bit slower, like I said, feeling the music, feeling the motion, and getting ourselves warmed up for what's to come. We'll try something a little bit quicker, and it's one of my favorites. We'll imagine that it's a bit of a party dance. And there's only a few things, again, that you need to know for this one. So I'll go through those and then we'll try it with music. We'll reach our arms up to the side with lots of energy in those fingertips and then reach them down to the opposite side. So we're crossing our body, reaching up and down. And then we're going to take a bit of a roll of our hands. That's it. And then we'll try that going the other way. So we repeat it. Up, down, and roll. That's it. From there, we'll keep that energy going in our fingertips and our arms. We'll reach those hands and arms up, again, as high as you'd like to go, and then freestyle it, dance it however you'd like, down. They might be in front of your body or beside. Totally up to you. We'll try that a couple times. And the last piece of this, we'll get our feet moving as well. So we'll focus on our upper body and our lower body with a heel out to the side, in, and then 3 stamps. 1, 2, 3. Heel, in, 1, 2, 3. Heel, in, that's the rhythm. Heel, in, 1, 2, 3. So we have our energy in our upper body with those reaches, our rolls. We have that energy lifting up, dancing it down, and then we'll finish with our heels. For this one, we'll do that sequence twice through. Here we go. I think for this one, we'll also feel the rhythm to begin. So you'll see me tapping my toe first. You can tap it like I am, opening and closing, or you can tap it on the spot. We'll get our feet moving, feeling the rhythm, and then we'll get into our reaches. Great. So I know that was a quick introduction and a quick feel for what our class might be like, but I hope that you were able to join in and participate and enjoy and have fun. Rachel, I'll pass it over to you to wrap it up.
Thank you so very much, Megan. That was a lot of fun. I'm going to just share my screen one more time. And hopefully with Megan that you've now been enticed to start dancing or to keep dancing if you're already dancing. And so if you're interested in accessing any of our programs, I've put the website link here. Please do head to it. And if you have any questions, please do feel free, of course, to also reach out to us at Canada's National Ballet School. Just before we finish, I just want to acknowledge the wonderful people and organizations who have generously supported this initiative. So thank you to all of them. Without them, we wouldn't be able to do what we are doing.
I'd really like to thank you, Megan and Rachel, for the time that you put into preparing for this webinar, and to thank all the audience members for their time and attention today.